So we don't have data. It's really hard to define now what T-cell exhaustion is, and we are generating data on whether spacing out treatment, so dosing with the delayed schedules, which is monthly, for example, can make a difference in this. Indeed, a fixed duration approach may fix this issue. This is again under development, but we still have no idea. So I think that for the meantime, we do have great data with bispecific antibodies until progression. And I think that if we want to replicate those data in the real life, provided that the patient is tolerating the drug, we should probably apply that strategy. Knowing also that in clinical studies, we're spacing out more and more this agent, so probably also monthly administration may be a good idea to balance safety and efficacy.